name is Mohamed Ghouse bin Nasuruddin. I teach at University Sains, Malaysia. I was born in Penang. My area of involvement is in theatre, dance and music. And lately I've been involved in therapy for special needs children, because sometimes we don't refer them as disabled children. They are special needs children. And in this particular instance, we use arts as therapy. A lot of us consider the arts merely as a form of entertainment or leisure time activities. You do painting, you dance, you play music just to relax or to develop a skill, or as an occupational activity. You learn, you earn by playing music, by dancing and so on. But there's another facet of arts as therapy that has been neglected by our educational system, right from the school and up to the university. Even the government agencies mainly consider the arts as entertainment. Art industry, music and so on. But arts as therapy has been used since time immemorial. The arts therapy. The arts here, we have both visual and performing arts. Visual arts like craft, painting, and a host of other hands-on activities. Performing arts involve music, dance, drama. These are used as therapy. They can be used for various levels of people. It can be for adults, and most definitely children. Children, in fact, views the world through images and through movements. You look at a child, the child will articulate anything he wants through the movements, a vocal inflection, or draws. He or she draws pictures to express. That's why art is important in school. But this is more of a basic educational tool to develop a different level of expression. There are in fact two levels of expression. One is a verbal expression. Verbal expression means you talk, you explain, you use words to communicate. The other one is a non-verbal form of expression. And here you use other elements besides words. Music, movements, and improvisation to communicate emotion. It is, some people, in fact, we refer it as a higher level of communication. For children, these are important. They communicate in that manner. What I'm going to delve into today is arts therapy for special needs children. Who are these children, special needs children? We have children, normal children. To us, normal children, they have full utilization of their physical body and they have their mental capacity according to their chronological age. Some may go beyond their chronological age and develop a mental capacity to fathom, to perceive things beyond their chronological age. Then the other category are the special needs children. These are the children who are disabled as a result of prenatal complication before they were born, or postnatal, within the 2 years. Within the 2 years of their birth, they may have other complication or accident. That's why it is very important for parents to take care of the children the first 2-3 years to avoid this kind of complication. What are the disabilities? Disability are the spastic children who have impairment. That is, they are either diaplegic, that means either limbs, either the legs are immobile, cannot be utilized, or the hands, or tetraplegic, 2 legs or 1 hand, or 2 hands, 1 leg, or quadriplegic, all the 4 limbs. So these are disabled children, and they also have what we call, they are mentally challenged. Mentally challenged meaning their mental capacity is not according to their chronological age. They may be 14 years in terms of chronological age, but their mental age can be 4. These are the mentally challenged. And then you have the visually challenged, those that we do not call them blind, we call them visually challenged. And also you have speech impairment, the challenge. They can't talk as a normal children. So we engage these children to develop, to apply arts therapy. We use art. Specifically, we use dance, music, movement, and play. Most important is that we use the music. So music therapy is a very big thing. You see, arts therapy will not cure them. You cannot cure them. But what we will do, it will develop a sense of achievement, feel-good feeling when you apply. As a game, as an educational element. It is both therapy and educational. We use music therapy. Music therapy, we use the gamelan because it has to be percussive. You cannot have complicated melodic instrument like the violin or the guitar because these children have difficulty even in handling things. So the most appropriate instruments would be percussive instrument, and gamelan really fits into that category. So drums and gamelan, sucking. And we have found that by playing the gamelan, they develop co-ordination. They develop the strength in their arms. They have developed a kind of awareness between the music and the striking action. Most of them in the initial phase find difficulty in even striking, but after 3-4 months, they could target it. Initially, when in the first day they played, they couldn't even hit the gong. It was going differently because they do not have control. The brain cannot control their physical movement. So eventually, we get them to target. And to a normal person, it may mean nothing. But to them and to us therapists, it is like a leap to the moon. They are able to control their movements and target it accordingly. Another example is you have one child A, we don't give their names, he drools. That means water always coming out from the mouth, drooling. So after undergoing the arts therapy, playing, striking, it distracts him from that and he concentrates on the striking action and the drool stops. Another patient, another child, who comes in first with a clenched fist. You can open it. But we coax him to hold the stick, eventually and open up. At the end of 6 months, he's able to open up the hand. This is really an achievement, a milestone to us, because what we are doing are non-invasive intervention. That is, it doesn't affect any internal intervention. It's mainly stimulating the body and the mind and the brain to create things. We also find that it is the benefits. There's a lot of benefits to that. Like music, it improves the articulation, their coordination, their ability to be aware of things, and it helps in their memory, because when they play certain phrase, it helps. So we keep repeating it and repeating it. Also, it affects their auditory energy pattern. You see, music will affect them through their brain waves. You have beta waves. Beta waves, when we have that kind of beta waves, from 13 to 30 hertz, it creates state of alertness and heightened mental activity. And you have the alpha brainwave pattern, 8 to 12 hertz. It relaxes you when you listen to music. And this is conducive. It is conducive for creativity. Theta brainwave pattern, it gives you a mental state, high concentration. That's music therapy. Dance therapy, we use dance therapy, we give them exercises, conditioning exercises to strengthen their muscles and to increase their articulation. And through dance, we do basic movement, sideways hand movement, leg lifting movements, rolling movements. And they go through all these simple choreographic patterns. The objective is to loosen their joints and to create flexibility in their joints, and also to strengthen their musculature. Dance gives you coordination, create strength, and create muscle memory. If you use the muscle memory, that means you remember your movement and develop what we call the kinesthetic sense. That is, you move without even thinking. So that means it has become part of you, part of your muscle. The other thing is the play therapy. Play therapy, we guide the student to enact different characters. It is not the normal play where you have a long dialogue. No, they use physical movements to create impression of various organic and inorganic forms. That means you can do movements to communicate the entity of a tiger or a tree, or for the less disabled who are able to have some vocal capability, we use simple dialogue. When we give them simple dialogue, then they articulate, it improves their verbal articulation. Play therapy or drama therapy helps the student, the patient, to live out a character vicariously, and they begin to enjoy the character. And through all these things, they develop their own sense of surrounding and the reality and interact. And it will help them in their daily life, which are a very difficult life. And it gives them a sense of good feeling. Part of play therapy, we used the traditional wayang kulit. And I wrote the play called The Boy and the Forest. It is an environmental piece where the moral value here is that we have to respect our surroundings. Here, the spastic children, they are all, most of them are on wheelchair. And this interesting part is that they handle the puppets, and the handlers and the therapists move the chair, move across the screen. And they are guided to draw up to create the puppets and then taught to move. And those without vocal impairment are given simple dialogue line to carry the storyline. And we used about 20 children of various disability to perform. Normally in a wayang kulit, only one person manipulate all the puppets. Here, one student manipulate one puppet. So we have to consider the traffic of wheelchair behind the screen. At the same time, we use the children also play the musical instrument. We use the bonang, gendang, and so on. And one interesting thing about the musician is one children who is spastic, diplegic, he is also autistic. And this child, the male child, whose chronological age is maybe 12, he has a photographic memory. We play out one phrase, he duplicates it exactly. It's interesting. And we are fortunate to have that kind of people. These autistic children have special talent, special facility, God-given facility that we normal people do not have. So they are not, sometimes we tend to regard them as special needs, but they have something beyond our normal physical and critical faculties. So the Boy and the Forest enables the children to combine visual arts, performing arts together and interact among themselves. It creates a sense of feeling, good vibes, a sense of, more important, teamwork. A teamwork that the realization that to have a performance, you need the energy and the work of different types of people, whether disabled or normal people, to develop creative performance. So the Boy and the Forest. Likewise, we had a dance performance, with a wheelchair-bound diplegic children, but has quite articulated upper limbs. She's on the wheelchair, and we normally combine a special needs person with a normal person. I dance the normal part, she's on the wheelchair, and we use various props like cloth movement to create patterns, movement patterns, also visual patterns. So generally, we can combine these three elements, dance, music, and play, into one format and give them a sense of awareness of how these things are combined and develop into a creative form. That can be a dance, that can be a play, that can be a musical performance. But arts therapy provides the opportunity for us to explore how to help, how to address the maladies of the special needs children and to create for them a meaningful existence beyond their physical disabilities. In conclusion, arts therapy is a very important element for children with special needs, and it has proven that it is viable to address their disability, but not to really cure them, but to give them better quality of life. And we hope arts therapy can be part of the school curriculum that would at least make the normal people aware of the plight of these people, and the arts therapy can be used to ameliorate and enhance their quality of life.